Olivia, you want to start?
Yeah, let's do it. Well, thank you so much, everybody, for joining. We're so excited for today's event. Before we get started, though, we'd love to know where is everybody tuning in from? What's your home country? Because I know we have a lot of international spread here. So if you don't mind just putting in the chat where you're tuning in from, we'd love to hear. Ooh, Arancha from Berlin. We got a US. Frankfurt, Kathy from Frankfurt. Wow, all the way from Kenya. Thanks for tuning in. Yeah, see, we have quite the spread. We'll let you keep posting those in. We'd love to know more. But thank you everyone for joining. Welcome to Egg Freezing 101, the egg extravaganza, as we've been calling it. We're so excited that you're joining us and that we get to tell you a little bit more about egg freezing. But I'll give you a little lay of the land, what we'll be discussing this evening. So starting with egg science, how egg quality and quantity changes over time, and kind of the why behind why we need egg freezing. Then we'll move into who should consider egg freezing and when, talk about the egg freezing process, and then finish up with Q&A. So just a round of intros before we get started. I'm Olivia. I will be your MC for this evening, but the true stars of the show are Dr. Lynae Brayboy and Ahmed Amer, and I'll let them give their own intros. So Dr. Brayboy, I'll hand it off to you.
Hi, everyone. Thanks for dialing in. My name is Dr. Lynae Brayboy. I'm an OBGYN and also a reproductive endocrinologist and fertility specialist, as well as an egg biologist. And I'm excited that you're here. So welcome.
And thank you very much for joining, everyone. My name is Ahmed Amer. I'm an embryologist, and I've been working in IVF since 2010.
Awesome. And before we kick things off, I do need to put out this lame disclaimer, but needs to be said that we're going to be giving you a lot of great information tonight, but that should not replace any individualized conversations with your doctor. And with that, I'll hand it off to Dr. Brayboy.
Okay. So first of all, thank you again. And why are we hosting this webinar? Well, I wanted to give you sort of my experience. So as a physician, I've had a lot of patients say, why didn't anyone tell me? Especially when they come in their late 30s and their early 40s. And someone says, well, I didn't know that delaying having children would cause me to have age-related infertility. And back when I was a fellow, it wasn't clear how we could help individuals, but that evolved. We started doing egg freezing for people who had medical reasons. And then we started doing elective freezing, but the word is not really out. And so we wanted to give you some awareness about what is egg freezing. So we're going to talk all about eggs, my favorite subject. I'm an expert. And I want to first talk about ovulation. So you probably remember from way back in sex ed, ovulation is when once a month, people with ovaries release an egg. And it's not really clear that that egg is a precious entity. It's actually the rarest cell in the body, as well as the largest cell in the body. And when you release an egg, it's called ovulation. And you have the lifetime potential to have 500 different ovulations, which sounds great, right? We don't actually fertilize 500 eggs typically. But when you're born, before you're born actually, you make all of the eggs you'll ever make in your entire life. And you continue to lose those eggs despite what you do. If you take birth control pills, if you work out and eat really well, you continue to lose those eggs in a process called apoptosis or atresia. And you lose those eggs by the time you're born, you only have 1 to 2 million eggs. By the time you get to puberty, you only have a couple 100,000. And by the time you hit menopause, it's down to 1,000. So you lose eggs as you age, no matter what. So we reduce our quantity of eggs. And let's talk about quality. Not only do you have less in quantity, but you also have less in quality. So this is a study that came out not too long ago from a lab in Denmark, and they looked at egg quality across the reproductive lifespan. So if you look here between your 20s, your early 20s, and your early 30s, your mid-20s and your early 30s, that is the optimal time because your egg quality is at its highest. And this is not the same for every single person, but you can see that there's this limited window to have the best quality eggs as well as the best quantity of eggs. And we know that the egg is important for pregnancy rates. And the reason we know that is because we've been doing egg donation for a very long time in assisted reproduction. And you can see the purple line here. So despite the age of the person who's carrying the pregnancy, the egg age is most important. So if you look at the purple line, the pregnancy rates don't change despite the age of the person who is carrying the pregnancy. But if you look at the person who's using their own eggs, which is correlative with their age, their chronological age, you can see that the pregnancy rates decrease over time. So the egg determines the pregnancy rate. So the egg age is most important. So the ability to freeze your eggs allows you to capture your eggs at the age that you freeze them. And that's the importance. That's the awareness that we want to bring. So here are some quick facts again. People with ovaries are born with all the eggs they'll ever make. And by the time you're born, you only have 1 to 2 million, and you lose most of those eggs through apoptosis or atresia or programmed cell death. You lose them no matter what. And some people will lose them faster than others. There's genetic reasons for that. There's also lifestyle reasons for that. And then number 2, you have this optimal time window to produce those eggs between your mid-20s and your mid-30s. And your egg age determines your pregnancy rate. The uterus, we say, doesn't age, but your ovaries and your eggs, they definitely do. So what should you consider, or why should you consider freezing your eggs? Well, again, like I said, we used to do it traditionally for people who had medical problems. So someone who had breast cancer diagnosis or non-Hodgkin's lymphoma, they need to have chemotherapy. The chemotherapy is toxic to eggs. So what we would traditionally do is freeze their eggs before chemotherapy administration. And if you have a family history or a medical history of early menopause, such as a Turner's mosaic or someone who has diminished ovarian reserve or premature or primary ovarian insufficiency, that individual is at risk for early menopause. Maybe Fragile X could run in your family. And so if you're at risk, you might want to consider freezing your eggs very early on in your 20s. And then if you're considering a transition with gender affirming hormone therapy, or you potentially will have surgery to remove your ovaries and you'd like to have genetic offspring, freezing your eggs first is always a good idea. And then electively, you haven't found your right partner, you'd feel pressured. Freezing your eggs allows you to have a layer of security. It's not an insurance policy. It's not a guarantee that you'll have a live birth, but it's an indication that, okay, if your eggs have good quality, we can thaw them later and actually fertilize them with the sperm or partner of your choice. And then if you're thinking about donating, you would have to freeze your eggs, because the way that we do egg donation now is that one person's eggs can actually help many women become pregnant because we can freeze them. So if you're thinking about being an egg donor, that's another reason to freeze your eggs. Let's talk about the freezing process now. So a lot of people ask, well, what should I do to get ready? There isn't a lot of data about the ways to optimize your egg quality, but obviously the eggs are very sensitive. Again, they're the rarest and largest cell in the body, but they're also the most sensitive cell. So anything that you are exposed to, your eggs are exposed to. So we encourage people to do healthy habits, practice healthy habits, limit your alcohol consumption. Okay, so alcohol is a toxicant. It's also problematic when it comes to eggs. We think there's not a lot of data. Don't smoke. We know that people who smoke cigarettes will have lower ovarian reserve and potentially can compromise the quality of their eggs. Avoid any illicit drugs. You don't know, first of all, what is in illicit drugs. There can be pesticides and fertilizers that could potentially be harmful and can alter the development. And we know that, for instance, there are cannabis receptors or cannabinoid receptors in the egg. So smoking marijuana may have an effect. We just don't have enough data to know. And we want you to get enough sleep. It seems like a no-brainer, you need to sleep, but having enough rest and proper rest is actually good for your overall health, which again affects your reproductive health. Avoid any environmental toxicants. Of course, we live and breathe air that we have no control over. The water, just a report came out last week that 50% of the water in the US is contaminated, but you can control the products that you put onto your body and what you ingest. So be careful of the fragrances, the cosmetics, the artificial colors, the food additives, your household cleaners and pesticides. All of those can have a deleterious effect on egg quality. And Ahmed will talk about a little bit what we do in the lab, but in the lab, we can't even wear perfume. We don't wear scented lotions because it can impact the egg quality. And of course, we want you to optimize your nutrition. You should be tested for deficiencies or anything that you potentially are lacking, because all of those things that you are eating, ingesting vitamins, they could potentially impact egg quality. Because again, the egg is the largest cell in the body, the rarest cell, and it has all of the mitochondria that the embryo needs to develop. And those mitochondria, which are the powerhouses of the cell, are important, and they need the nutrition, the vitamins that you eat and consume. Okay, now we're going to talk about the whole process. It takes less than a month. It should not impact your life. You shouldn't have to take a lot of days off of work, and it's actually not that scary. So what you typically do is you have a consultation with a fertility specialist, a board-certified doctor like myself, and we review your whole history, your family history, your medical history, what medications are you on, have you had any surgeries, all of those types of things we need to know. And then we have you go through diagnostics. Why do you need diagnostics? Well, we need to know what's your ovarian reserve. So there are some tests that we can do that can have an indication of your ovarian reserve. One of those is AMH, or anti-Müllerian hormone, as well as an antral follicle count. So we do those tests to have an idea of how you will stimulate. And we also need to do all of the prenatal labs that you would get done before you get pregnant anyhow. And then we have you come in for a follow consultation, and we go over those tests. Now, we don't have to have you come in because now with telemedicine, we can see you remotely. And that's a great thing about technology. And then we do stimulation. And stimulation means you take medications so that your ovaries become stimulated and you make more eggs than just one that you would normally ovulate once a month or once per cycle. And that stimulation could be in an office, or it could be at home with a concierge nurse. And so the other thing that you have to do is you have to take a trigger shot. The trigger shot allows the eggs to mature so that when we do the retrieval, that they're ready. And let's talk about the retrieval process a little bit. So the retrieval is only about 15 to 20 minutes. You go to sleep, nothing down your throat. It's just through your IV that you have a nice rest. And then when you wake up, we tell you about the eggs, and we also tell you what we were able to freeze. So again, not a process where you have to take off the whole month. You only need to take off the day for the day of the retrieval just because of the anesthesia. We want you to really just kind of rest and recuperate and just go home and watch Netflix and chill. So how many eggs do you get at the retrieval? It depends. Again, everything in reproduction is age dependent. So we've already said that the quality and quantity decreases as you age. And this is a graph from a group that said, how many eggs do you get at the different ages? So you can see to the left of the graph, if you're very young, 23, you're at the extreme of your reproductive lifespan, you have the highest numbers of eggs. So about 12 eggs on average. But as you get older, at the other extreme of your reproductive lifespan, your egg numbers decrease all the way to about 6 on average, less than 6. So you can kind of gauge what you might get if you freeze your eggs younger versus then later. So I'm going to pass it over to Ahmed, who's going to talk about what we see in the embryology lab. So after we've done a retrieval, then the nurse hands over the vials with the follicular fluid, which have the eggs in them, and the embryologist takes a look.
Thank you very much, Dr. Brayboy. So I wanted to break down some important facts about egg quality for you so that you're able to make an informed decision if you decide to go through with this journey. So I just want to emphasize that not all eggs are created equal. What you see on the left is a picture of a good quality egg. On the right, however, you see some egg cells that are of suboptimal quality. The appearance of the eggs can vary greatly. It can vary from patient to patient, cycle to cycle, but even within the same cycle, we expect to see these variations amongst the eggs. Eggs of suboptimal quality often have a lower chance of successful outcomes. Now, it is important to remember that these assessments that we make of eggs are quite superficial and only tell us the story of what's happening on the surface. Traditional microscopic evaluation can't really assess the molecular health of the egg. However, with the advancement of computer vision technology and artificial intelligence, we can now have a more robust analysis of the eggs that can give us objective and more accurate assessments of the overall health and quality of the egg. But remember, the greatest and most important factor in assessing egg quality is the age of the egg. So with all these different variations and variables in egg quality, how many eggs do you actually need to get pregnant? On the left here, you can see a graph that shows that as age increases, the number of eggs needed to have at least one live birth also increases. This leads us to the discussion of success rates of egg freezing. The average percentage of eggs that survive the freezing thawing process is 70 to 95%. This is highly dependent on a few factors, including the age of the egg quality, which we just discussed, and the treatment protocols at the clinic. It is very important to note that any data we have on egg freezing is quite limited. This means we generally recommend having around 15 to 20 eggs frozen to give yourself a realistic chance of at least one live birth, and that it can take more than one egg freezing cycle to get to that number. Over to you, Dr. Brayboy.
Thank you so much. So let's talk about the risks. What are your risks doing an egg freezing cycle? Let's talk about the egg risk first. There's always a possibility that you don't have any eggs retrieved. That could be because you have what's called diminished ovarian reserve, and your eggs are not, or your ovaries are not able to be stimulated to actually retrieve the eggs. There's also a possibility that sometimes people don't take medications accurately. It's very confusing. There's lots of medications. And so you want to look for a clinic that actually supports you in being able to take those medications, and they're very timed. So you definitely want that support in any clinic where you go. And then there's always a possibility that the eggs are poor quality. Currently, there's no way to know ahead of time before the retrieval if the eggs are poor quality or not. When we actually do the retrieval, as Ahmed just said, we would actually look at the eggs and determine the quality before you freeze them. So you would have an idea if they will survive the thaw or not. And that's an important thing. You want to ask about that when you interview a clinic. And then there's always the possibility that few to no eggs will survive the thaw. As we just said, the thawing rates are variable, and that's possibility in the future. And let's talk about the medical risks. Of course, you have to take medications to do the stimulation. The stimulation medications are associated with some symptoms, such as breast tenderness, bloating, nausea. These are typical symptoms, but they're not worse than what you would normally feel during PMS. And of course, there is a rare side effect of ovarian hyperstimulation syndrome, but your doctors will watch for this syndrome very, very carefully. And those are the majority of the risks. So let's talk again about clinic selection. How do you pick a clinic? First of all, one important factor for many people is cost. Depending on where you live, the federal government may not cover your egg freezing cycle. And so it's important to shop to make sure that you're getting the best money or the best value for your money. And you want to find out, what are the clinic success rates? How do the eggs survive when they do thaw? And so this is important. And right now, most of the clinics do report into databases, but not every clinic. So you want to ask them about what technologies they use, because it sounds nerdy, but IVF is a technology. And so if they're using technology from 1978, when IVF started, or are they using the cutting edge technology that's on the market? And then the last question that you want to ask is, how will the clinic support you throughout the process? Again, it can be difficult, especially if you're going through a cycle by yourself, and you want to find out, what is the nursing support? What is the social support? Is there any community that you can join of other people who are going through this process? That's an important question to ask the clinic. Okay, so I think we've come to the end of our presentation, so I'm going to hand it back to Olivia.
Perfect. Thank you so much, Dr. Brayboy and Ahmed. Now we're going to turn it over to the audience to ask questions. So if you want to put your questions in the chat, you can message me directly if you don't feel comfortable, or you can do the raise hand option in Zoom and come off mute. But happy to take your questions now, and then I'll give us about 20 to 25 minutes, and then we can stay on after as well if people want to ask more questions. Okay, first question from Arancha. I have heard that it is better to freeze embryos. Is that correct? What happens to eggs that are not fertilized after the freezing?
I'm going to give that one to Ahmed, then I'll give my 2 cents too.
Thank you, Dr. Brayboy. So great question, by the way. It is true that embryo freezing is more successful than egg freezing. And the reason that is the case is based on mathematics. An egg is a single cell, whereas an embryo, when we freeze it, is about 150 cells. So it theoretically, if that embryo loses half of its cells, so if 50% of those 150 die due to the freezing thawing process, that embryo is still considered viable. It can still continue developing and recuperate those lost cells. However, in the case of an egg, that single cell, once any damage is done to that egg, that's it. So that is why embryo freezing is more successful than egg freezing. And in terms of what happens to eggs that are not fertilized after freezing, so it depends on why were they not fertilized. The main reason would be if we froze those eggs and we came to thaw them and came to fertilize them, they did not survive the thaw, they would be discarded. And there are protocols and ways in which you discard cells such as embryos, sperm, and eggs. So there are certain protocols of how we deal with the discard of these cells. There are other scenarios where they can fertilize theoretically, but fertilize abnormally, meaning they're not technically viable embryos and they cannot lead to a viable pregnancy. So again, similarly, they would be discarded. Any eggs that are not suitable for freezing to begin with are similarly also discarded in a way, but you have to consent because there are different pathways that you can take for those eggs. Either you can donate them for research, donate them for training, or some patients do still want to freeze those non-viable eggs, whether it's for religious or ethical reasons. You can definitely still do that.
Yeah, thanks for the question. I think also we've been freezing embryos for a much longer time than we've been freezing eggs. And just remember that an egg is the person's property. So it's your gamete, so it is your property. But in many locales, in many countries, the embryo, unless you're using a sperm donor, is also the property of the person who donated the sperm. So it's something to just think about. So if you are a person who wouldn't want to have a legal battle with your partner about embryos, it's sometimes better to freeze eggs and use donor sperm to make embryos if you're thinking about using them in the future and having complete control and exercise that complete control over them. Because right now they are property. Any other questions in the chat, Olivia?
Not yet. Anybody want to come off mute for a question too?
I guess I'll just maybe do my other 2 cents. You can freeze eggs and embryos. You can do that. You can split the eggs and you can actually freeze part of the eggs, half of the eggs, and then fertilize the others and freeze embryos. So that's a possibility. No other questions? I'm glad it was super crystal clear.
We covered everything clearly.
Oh, we got another one. Would you still say it's best to freeze before your 30s or wait until you get there?
So there's no data right now that says the best time to freeze your eggs. All we have are the data that we showed you. So I would say if you're thinking about freezing your eggs, why wait? Because you're not sure of what's going to happen in the future. You may have a diagnosis in the future. You may be exposed to something in the future. I think, again, that window of your mid-20s to early 30s is probably the optimal window. But remember, we can't tell for individuals. We can't tell if you have an accelerated ovarian aging or if you have a normal pace of ovarian aging. So some people will reach the menopause early. As I said, they'll go into menopause before the age of 40. And those individuals, 30 might be too late. So there's no way of knowing. We can do markers of ovarian reserve, which gives us an indication. But really the best test for egg quality is once it's fertilized and once we can actually even look at the egg and make an assessment. Ahmed, do you have anything else to add to that?
Yeah, I also want to say that obviously at the end of the day, also it's down to personal circumstances. So we don't want you to feel like you have to freeze ASAP. We're not also fear mongering, but it's just like Dr. Brayboy said. It's about getting that balance and thinking whenever you feel like you're comfortable and ready to make such a decision, then make sure you get well informed, reach out to professionals such as ourselves, and we can always help and guide you and tell you when is best, because just like Dr. Brayboy said, it does vary from person to person. Some people's varying age may be different to their actual age, for example. So it is quite a personal question.
I know one question that I get asked a lot is about the impact of birth control on fertility. Can you speak to that at all?
Of course. So a lot of people think, birth control, I took birth control forever and that's what caused me to be infertile. Or I took birth control and I think it messed up my body. There's really no data to support that. But unfortunately, what happens is when people have issues in, let's say, their adolescence or in their puberty, they are often treated with birth control. And so when they are taking birth control, they're not having a spontaneous menstrual period. They're having what's called withdrawal bleed. So you're not actually aware of your normal menstrual period. And then when you come off birth control because you want to try to get pregnant, and you can't get pregnant, then people say, it's the birth control. But actually the birth control was masking whatever was happening throughout their reproductive lives. So birth control doesn't cause you to have infertility. In fact, we actually use birth control in some of the protocols that we do for in vitro fertilization and also egg freezing sometimes. So birth control is not something that causes infertility. And in fact, birth control does have some medical benefits. So it does decrease your risk of ovarian cancer. It does decrease your risk of uterine cancer. But if someone's not taking birth control pill, they do have the advantage of seeing when changes happen in their menstrual cycle. So if you're tracking your period, so I used to work for CLU as the chief medical officer, and I encourage people to track their periods because you get to see changes in your own menstrual cycle. And when things start to change, you should take note because that is an indication of what's happening in your ovary. You having a menstrual cycle means that your ovary is working properly and that your brain and pituitary and ovary and uterus are all in sync. And when you stop having a period or when your periods are lighter or when the flow changes or when the cycles get shortened, then you want to have a conversation because that could be, again, a potential marker that something is changing in your ovarian physiology.
Thank you. And we did have another question come through the chat. What makes an egg of high quality? And what are the factors beyond just egg age?
I'm going to let Ahmed start with that one, and then I have another one. I have another addition to that.
Perfect. And yeah, there's also another question that came before that, but we'll answer that after this one. So what makes an egg of high quality? So yeah, egg age is one of the biggest factors or assessments of egg quality, and it is one of the main parameters used in traditional clinics or traditional labs to assess egg quality and subsequent embryo quality. Usually, traditionally, what we would do is assess the egg under a high power microscope and assess if it's a mature egg or not. So meaning it's at the right stage of development for the egg freezing process or not. And we also we grade down an egg. So we know what an egg looks like. And if an egg doesn't look like that, then we would grade it down based on what it has. So sometimes they have little vacuoles in them. So they're like little craters growing in the eggs that affect egg quality. They can be misshapen. They can look slightly grainy in color. All these affect egg quality. And this is how we used to traditionally kind of assess eggs. Now with the advancement of computer imaging and AI, there's a lot more than we could assess. Stuff to do with the elasticity, for example, of the membrane of the egg. How sensitive is the egg to changes in media, to light? So for example, also in most labs work in very dimmed light or have to have certain types of light that do not affect the solutions and the cells growing in culture. So even looking too long under the microscope at these cells may theoretically affect their quality. So the advancement of this technology helps us really assess things that initially we could not see, technically not with the naked eye, but with the naked eye under a microscope. But still, we would definitely say that the age of the egg is probably the most important factor in assessing its quality for long-term development, particularly with regards to fertilization, embryo development, and most importantly, implantation and live birth rates.
Yeah, and my perspective is that there's a whole nother world that we still don't know about eggs. So I'm an egg biologist and I study egg mitochondria. You may have heard of mitochondria back in high school. They're the powerhouses of the cell. They make ATP. ATP is the energy that the cell needs. And guess what? The egg needs lots of that energy. And so right now, there's not a test to look at egg quality in a physiologic way. So do we know if this egg is high quality or not? Again, it's just morphology right now. But we at Ovum, we're interested in actually developing that technology so that at some point in the near future, we can look at subcellular organelles such as mitochondria, which are, again, the powerhouses of the cell, and we can assay whether or not they are in top shape or not. And that's what we aim to do. We want to be the IVF clinic of the future. And unfortunately, traditionally, many people just use the subjective expertise of the single embryologist that is looking at those eggs. But again, we implement AI technology to make it better. So I think in the future, we'll be able to answer those questions about what is really the quality of this egg before we go through the process of freezing it, before we go through the process of fertilizing it.
Thank you. Arantxa, I'll come back to your question in a moment, but I think this one's around the same topic. So Kelsey asks, since IVF is a technology, what new technologies are being produced in this area? What should I be making sure that a clinic has?
Yeah. Ahmed, you want to start and I'll wrap it up?
Of course, yeah. So IVF is rapidly evolving. Like we've gone so far in just a few years. Similar to everything right now with AI, suddenly AI is all over and all around us, and it's very similar also in IVF. So in the field of IVF, AI has been trying to be implemented for a few years now. And I'd say over the past year or two, finally, it's come to the forefront of assessment in terms of imaging, embryo selection, egg selection, even sperm selection. And there are even now devices that are actually taking a lot of the manual work or the technical work that we do with our hands in the lab and automating it. So a lot of the procedures that we do in the lab are very, very skill dependent and very skill based. And now they're developing technologies to kind of standardize these procedures. They're not out there yet, but pretty soon I suspect all this technology will be ready. But what we have currently is all these assessment tools that help us select better quality eggs or grade eggs better, select better quality embryos, and assess embryos less invasively as well. So traditionally we tend would, for example, take parts of the embryo to assess. They're now developing technologies where we don't have to actually like biopsy a few cells out of the embryo. These technologies are not there yet, but they're getting close. Similarly, also, we can select better sperm. Traditionally, when you select a sperm, you look under a microscope and you select it basically just with what you see. Now there's a lot of AI tools developed to map the way they move, the patterns of their movement and their behavior under a microscope, and that is used to map out that sperm's chances of naturally fertilizing the egg. So that would let us know like this sperm is more likely to have fertilized the egg naturally, so we take that sperm, for example. Before that, we could not do any of this. I would just look at a sperm that is moving. I could see that it's moving okay, it looks all right. We take that sperm and we inject it. Now we're just adding so many parameters that we can assess and test for before creating embryos and after creating embryos to select the best ones for you. And I don't want to take us on a different loop, but theoretically speaking, CRISPR technology as well, gene editing can potentially have a role in IVF in the future, but strictly for the role of removing diseases from a line, basically.
Yeah, from an embryo, yeah. And for the patient, from the patient side, what technologies should you be looking for? So what helps you to take your medications, right? So you get literally prescriptions, and then you have to pick up a lot of medications, and you have to know what to take, when, and how to take it. And that can be very daunting, especially if you don't take a lot of medication. I mean, I would love to do a show of hands if I could see everyone. How many of you have taken a birth control and forgotten to take your pill? That would be me. So if you're trying to take a lot of medications, how do you organize yourself? So does the clinic have any support mechanism? Is there anyone who can come out and give you injections? And is there anything online that they can give you in terms of instruction on how to give the injections? Is there any calendar that they give you? So for instance, we have a patient-facing app, for lack of a better word, where you can look at your daily medication reminder, and that gets updated by your care team about how much medication you should be taking, if we need to change it. If your stimulation is going really well, then it stays the same. If we need to, increase it a little bit, then we would need to tell you through the app. And then you would know, okay, don't forget to take it at 7 a.m. You'd be able to have those reminders. Don't forget to take your 7 p.m. injection. Don't forget to take your HCG. I have a colleague who has a clinic and in the States, and one day she had 4 people forget to take their HCG, which means they could get no eggs at retrieval. So it's really supporting the patient to help them do this journey. And you want to look for that tech-enabled support mechanism. And also, how do you communicate with the clinic? Most clinics you have to call. You have to call. Sometimes you can email. In the US, we can't really communicate things via email. So, you call and the nurse calls you back at 2 p.m. right when you're in the middle of a business meeting that you're presenting. So we basically at Ovum have this way that we can do this two-way communication so that you don't have to take phone calls. You don't have to try to get through. You are always connected to your care team 24/7. And I think those are the types of things that I would look for as a patient in a clinic.
Great, thank you. Going back to Arancha's question, I'm also a bit concerned about where the eggs go, where they're stored once they're frozen. Are these banks safe? How do I make sure that my eggs will be safe and there will be no mix-ups given to somebody else or damage?
Ahmed, you go first, and then I'll talk about banks versus clinics.
Of course. So that is a great question, by the way, because I pretty much get asked this question every single day at the clinic. And you have every right to ask this question, and whichever clinic you decide to go to in the future, if you decide to go through this, I definitely recommend that you still ask them this question. How do you make sure that you're freezing my eggs, or you're inseminating my eggs with the sperm that I want, or you're putting back my embryo, or there's no mix-up happening? It's in the UK, it's actually mandated by law here that every single step that is taken in an embryology lab is double witnessed. So that can be done in two ways. I'm doing a procedure, for example, so I'm about to freeze some eggs. A colleague of mine has to be over my shoulder, making sure that I am freezing the eggs for patient X, and they're going onto these labeled straw that has patient's X's details, for example. So every single movement of the egg or embryo or sperm through the embryology chain is witnessed. It's very kind of labor inefficient, but to be honest, it gives patients peace of mind, and it gives us as well peace of mind. Nowadays, also, there is technology that replaces me having to have someone around me. So we work in like these little hoods or desks, and as I'm in that hood, before I enter that hood, for example, I would say I'm going to freeze eggs for patient X, and everything is pre-labeled with like a barcode or RIFID. And if I enter that hood with stickers or barcodes that don't match, this thing alarms and would make you go deaf, basically, letting you know that there's a mismatch there. So again, that's another way of testing. And I've actually worked in clinics that use both methods. So they've got the alarm system and the cameras set up to monitor all the stickers. And I have a colleague also just over my shoulder, making sure that I am doing the right procedure for the right patient. And then that same thing applies when those embryos or eggs or sperm go in a cryogenic tank where they're stored. By the way, all these materials are stored in liquid nitrogen at minus 197 degrees centigrade. I don't know what that is in Fahrenheit, but it's really cold, really cold, basically. So cold, if you put your finger in there, that your finger will drop off.
Yeah, it would burn. It would burn.
Yeah. Might potentially drop off if you leave it in there, but I don't think anyone would leave their finger in there.
And yeah, hopefully not. Hopefully not.
Yeah, so everything that goes in these tanks again is pre-labeled and it has to match your patient record throughout. So again, on your patient record at the clinic, it will say that you're in this location of this tank, for example, with this ID. Nowadays, there is actually a state-of-the-art storage system that we will be using at Ovum that again utilizes RIFID and it is so secure. I think it was developed by the US military, so it is extremely secure that I don't think anyone can ever mess up or make such a mistake, for example. And these tanks are always monitored and alarmed with temperature sensors and liquid nitrogen sensors to make sure that the cells are always covered with more than sufficient liquid nitrogen and that the temperature does not drop more than a few centigrade, or rise, not drop, than a few centigrade that may affect their viability. So that's regardless if you're using that ultra safe system that we'll be using, or even the standard basic system, which is like literally a metal tank with liquid nitrogen and some temperature monitors stuck on the outside.
Right, absolutely. And I just want to address what's the difference between a bank and a clinic. So a clinic typically has their own storage on site. And so just as Ahmed said, there's this very new, wonderful, secure cryo storage that would be on site. But a bank, really what they do is they reimburse individuals who are egg donors. And so they do a retrieval, they do the freezing, and then those are sent to an actual bank. Think of it like a sperm bank. And so you could go online and decide, okay, I want this person's egg, or I want this person's sperm. It's similar. And they are preserved for people who want to then use them to become pregnant, the intended mother or the recipient of those eggs. So that's an egg bank. That's different than a clinic. Some clinics do have their own egg banks, but that's really a separate entity.
There was a question earlier in the chat about how many months do you think the entire process takes in total from first consultation until retrieval? I'm not sure if we answered that.
I think we did not answer it in the presentation. We said it takes less than a month. So less than a cycle. Yeah. So you don't need, this shouldn't be a months-long process. It's very possible that you could do the diagnostics and also the stimulation in one cycle, depending on when you got the blood tests and when they were resulted. So it could be as little as a month, but of course, if you need to do multiple cycles to get that 15 to 20 eggs, then it could be several months.
And how long on average are you taking the medication for, the stimulation medication?
It depends on the individual, but 10 to 12 days, I think, is average. It really depends on how quickly your ovaries stimulate. If it's too stimulated, of course, there could always be a cycle cancellation because we don't want you to have ovarian hyperstimulation syndrome, but that's usually very rare. I think most clinics are committed to the safety of their patients and also make sure to monitor them and not overdose them, because overdosing is more costly to you. You have to buy more medications, and the ovary doesn't necessarily respond well to high doses of stimulation with what we call, the drugs are called gonadotropins. So.
And I just want to add to what Dr. Brayboy was talking about in terms of how long it takes when you start taking medication. So it takes 10 to 12 days, and you collect your eggs we collect your eggs as soon as we collect the eggs. By the way, they're frozen and stored straight away. So chances are, by the time you wake up from anesthesia, those eggs are already stored for you.
Yeah, that's right.
So it has to happen straight away.
Right. Eggs are sensitive, so we don't let them hang about. We immediately get them ready for freezing, and then you want to check with your clinic. How are you made aware of what was frozen? Do you have to call? Do you get a fax? Do you get an email? Or does it appear directly in a patient app? How many eggs you have, what the quality is, and what we think the chances of those eggs, resulting in a pregnancy. So you want to find out about the communication process, because I think, like anything in life, communication is everything. So how are you getting this information?
Yeah, and also most clinics would be contacting you every year to bill you for the continued storage of your eggs. And sometimes that would also require you making signing consent forms to extend the storage, depending on how many years you've agreed to store your eggs for, and also depending on which country you're in, because according to it depends where, based on which country you've frozen your eggs, there is a limit as to that how many years you can keep them stored. So, for example, in the UK, you could have kept them up until 10 years, up until recently. So you could only store your eggs for 10 years. Up until 2 years ago, they changed the law to 55 years. So the UK currently, you can freeze your eggs for a very long time. Other countries have shorter storage periods. Sometimes you're even limited to up to 3 to 5 years with storage for your eggs. So that's a very important question to ask before you go on to in that process to your clinic. How long can I keep my eggs frozen for?
Great. Okay, I think we have time for one final question, and then we have a raffle giveaway. So be sure to stick around until the end. And I think that raffle giveaway will also answer your question, Marco, about biological age tests. So just hold on. But last question coming from Felicia. She asks, is there a connection between the number of eggs that can potentially be retrieved and being an endo patient? Endo meaning endometriosis.
Yeah. So we know with people who have endometriosis and who suffer from it, the egg quality can be affected, but of course, it doesn't necessarily mean that the quantity may be worse. So it really depends on the stage of endometriosis, and staging means that you've had a surgery and a surgeon or a gynecologist has had a chance to look at your ovaries, your tubes, your pelvis, and tell us what's happening. Because what happens sometimes with endometriosis is that it can be very extensive, and it can cause there to be maybe cysts or scar tissue that could make it difficult for us to do a retrieval, especially if the cysts are quite large. They're called endometriomas, and they can get in the way of us getting to follicles. And so those are the types of things that can potentially impact quantity, but the quality is more so the issue. As we said, the eggs are very sensitive, and endometriosis is an inflammatory state. And so the eggs can be impacted by that constant inflammation that they're exposed to. And so we do see that there are some egg quality issues with endometriosis. Having said that, that's not necessarily true for everyone, and not everyone has the same stage of endometriosis. And the pain level associated with endometriosis is not necessarily correlative with the stage always. Okay, should we move on then?
Yeah, I think it's raffle time.
Okay, yay. So I'd like to introduce my colleague. It's Nicolina Lauck, who's going to talk from GlycanAge. And we have met before at several women's health conferences. And we plan to do a study together because at Ovum, we're interested in the research and development in the field of women's health. And so GlycanAge is our raffle partner tonight. And so I'm going to let Nicolina talk about it.
Cool. Can you see me and hear me?
Yes, we can. Over to you.
Myself, but okay, I can see myself. Nice. So as Leanne said, this is a collaboration between a research collaboration between the two of us. But I'll first start explaining why it's important. So our mission as a company is to delay disease. That means extend your health span, but it also means extend your healthy reproductive health span. So we can go to the next slide. So how we do healthcare today, we wait for you to get ill. And then when you have a pain and a symptom, you enter the healthcare system and we treat this disease throughout life. But actually this decline that leads to disease starts with aging on an early molecular level that can happen decades before you experience symptoms and you get diagnosed with a disease. And we call this biological aging, which can also be very different to your chronological age. So your chronological age could be 30, but your biological age could be 20, it could be 40, it could really vary. And then that would later on develop into chronic disease, and then it will go on to frailty, what we visually see as aging. And previously, we didn't have tools to preempt disease. We didn't have a way to measure this decline on a molecular level so we can tell you where you're heading towards. And now we have new technologies that enable that. And one of the key technologies that is enabling preventative and also personalized medicine is glycomics. And it's a field of biology that not many people have heard about, but pretty much everything in your biology is coated with glycans. All of your cells, proteins, lipids, they enable our biology to communicate. So the reason we are multicellular beings is because of glycans. If we didn't have glycans, we would be single cell bacteria. And they actually play a key role in conception. So the reason we have conception is because sperm coats itself in glycans and sialic acid to avoid the woman's immune system and enable conception. So they play a role pretty much everywhere. And what we, so if you go to the next slide, what we actually measure is biological age through aging of your immune system, or something we call inflammaging, which is accumulation of this background level of chronic inflammation that starts very early on, and from your teens, and then slowly accumulates with time. And this was one of the first aging clocks that was ever developed. So we are now is an aging clock. We're 10 years old. And this field of aging clocks is actually 10 years old. So we were one of the pioneers. And if we go to the next slide, and one interesting thing we saw that you don't really see across many or all biomarkers is there's quite a gender difference. So we do see that hormones play a big role in the curve of aging. And if we compare male and female, we see that they have different aging curves. So if you, I don't know if you can see my pointer, but if you look at the blue lines, these are men, they go, or they go up in a straight line, and women generally have more favorable or scores, or they do have lower chronic inflammation in reproductive age. And then as they near menopause and perimenopause, they see this rapid aging. And in basically menopause is one of those big aging events in women. We see them usually move slower before that. And if you go to the next one, last year, we looked at the menopause transition, but starting with perimenopause, so years before you lose your cycle. And we saw that this acceleration in inflammation happens decade before you actually get to menopause. So what we're doing with ovum now is looking, and this does also connect with other hormonal imbalances like endometriosis, PCOS. There's a big connection with this chronic inflammation and hormone balance. So what we're doing with ovum, we want to look at how this, is this connected with ovarian aging or egg quality? And we also want to see if we can potentially alter this through lifestyle interventions, and that might change an outcome. So if you improve your lifestyle and improve your biological age, will this also have a better outcome in egg freezing? And on the last note, I just want to, so we have a raffle. One participant today gets a test, and this will be part of the study with ovum, but it's a finger prick blood test, 4 drops of blood. Tells you your glycan age and also the composition of these 29 glycans we measure, and you have a consultation connected to it that will give you an action plan on how to improve your biological age. So
thank you so much. That's wonderful. So, all right, if you're ready for the raffle, the question is whoever answers the question first wins. The question is
and you have to post in the chat. It's the first person to write in the chat first.
Thank you. That's important. Can't blurt it out. Ready. How many eggs do we have, people with ovaries that is, how many eggs do we have when we are born? Okay, we got one answer from Arancha. Anybody else?
2 million, 1.5 million.
Anybody else? Okay.
1.5, 100K, 2 million.
All right. Well, we have a winner. Our winner, the first person to put the right answer was Arancha Gomez from Berlin. So you have now won a glycan age kit so that you can potentially understand your molecular age, and perhaps in the future we will have data about how that actually reflects your ovarian age. So thank you all for coming. Thank you for participating. It was a lovely, lovely experience. If you want to learn more about your own reproductive health and potentially egg freezing, you know where to find us, www.ovumcare.com.
Thank you, everyone.
Actually, did I say that? I said the website right? I hope I said the website right.
Ovumcare.
Yeah, okay. Wait, did I say that right? Yeah.
We can also stick around for a few minutes if anybody wants to talk with any of us four. But thank you so much. Any questions?
Yes, yeah, I was very happy to hear that extended the UK egg bank time to 55 years. Because when I did it 4 years ago, it was only 10 years. So
Okay, I think we're good then.
Okay, thanks everyone. Bye.
Yeah, thank you.
Thank you. Bye-bye.
Bye-bye.